World Cancer Day. This is a day set aside by the United Nations, and the theme this year is I Am, I Will. You are the hero of the story. Many initiatives nationally and globally to mark this day, and one of them is Pink Drive. From the Department of Health, we're joined now by Sandhya Singh. From the Pink Drive, we're joined by Dr. Ashwin Hurribunce. Thank you so much to both of you for joining us today. Sandhya, how is the Department of Health interpreting World Cancer Day this year?
Good morning. The Department of Health is presently on a mandate given to us by the President, President Cyril Ramaphosa, when he announced in his SONA 2018 that he would like a drive, a campaign on cancer, which is very similar to that of the AIDS drive. Hence, we have, over the last year, engaged many initiatives talking to cancer establishment, strengthening of services, and also making the public more aware. So the department, the minister, sees today as having been a build-up from the President's call in his SONA last year. And I'm quite sure the President is going to be asking the Minister of Health for an update on where we are at the moment.
Yeah. What activities are you embarking on today?
Well, the Department of Health, not directly. There are many other activities that are in process with regard to strengthening of services, decentralization of services, and of course, while we are not directly partners, or we will support the initiatives of the Pink Drive in their event this morning, the department is not a direct partner.
Dr. Hurribunce, on a day like this, I would, well, at least in the past few years while I was at Morning Live, I would be out in a taxi rank showing the work of Pink Drive, the tests that you were conducting on men and women, and also talking about the awareness. What are you doing today? Where are you this morning?
Thanks, Desiree. I'm wearing blue today, not pink.
I can see.
It's the man thing as well. I think I'm emphasizing on the focus on men as well.
Yeah.
Well, since 5 o'clock this morning, Pink Drive was bright and early at the East Bank Clinic in Alexandra Township. It's our 10th year of existence, and we said we're coming back home to celebrate this World Cancer Day. Home is Johannesburg. Ferndale Randburg is where home is. So City of Johannesburg became the natural partner for us to actually be able to show Pink Drive again in the city limits.
Yeah.
And not just to paint it pink, but to make sure that there's the blue as well. So today, sporting the blue.
In fact, that's the conversation we kept having when we had these tests, that men were being tested in one truck and women were being tested in another truck. It's not a gender neutral condition, is it?
Absolutely.
It affects both sides.
It absolutely. The disease doesn't discriminate on any factor.
Yeah.
However, Pink Drive is elected because of the nature of the impact of cancer on South Africans. We elected to go specifically for the gender-related cancers purely because of the statistics, and I would leave the Department of Health to actually provide that to you, and probably the Minister might do so as well. But for ourselves, we are clear. It's about everybody, and it's from the young all the way to the old. You'd remember, Desiree, in those years of yore, we were just looking at women and we just only look at breast cancer. But today we have realized that we cannot be a platform unless we speak to everybody about cancers in general, raise the awareness about cancers in general. Also, with the Department of Health as a direct partner, raise the awareness about good health whilst we're doing that.
Absolutely.
But the services are largely to go and screen those patients who might not be aware they are actually inflicted with this disease, especially those who had family history. The statistics always show that if you had somebody in the family with cancer, you need to come forth quickly.
Yeah.
Because if you do pick up quickly,
you might have genetic
we could take you through, and we take you through to the same Department of Health.
Yeah.
There's no other alternative. We've got strong agreements with provinces to do so.
Sandhya, it's one of the most researched medical conditions. What's the latest in terms of medication, in terms of prevention, in terms of things that people can do to try and not be affected?
So our first win is to, in those cases where we can prevent it, is to prevent. And that, referring to my colleague here, is to look at in those instances, behavioral factors, for example, tobacco and use of tobacco products. The second win would be vaccination.
Yeah.
And here we're talking about especially the HPV vaccine. And South Africa at the moment is leading the pack in terms of best practice, in that since 2014, since the minister launched the project, South Africa has vaccinated over 1.5 million 9-year-old girls. So we would expect to see impact studies in around 2022, where we would start seeing changes in trends. So the first stage is let us prevent if we can. Of course, some are hereditary and we can't. Then if we can vaccinate, let's vaccinate. But then there are many cancers, if identified early, can be treated and cured. And in this particular case, we're talking about the cancer that's killing our black women, cervical cancer, which if identified early can be treated. Precancerous cells can be treated and cured. What we need to do is to make sure our health services are responsive to the needs of our people, as well as people being aware of what their rights are to health services.
I like what you're saying about the health service being responsive to the needs of people, and you have so much control over how much the public health service. There's a conversation going on as well about how exorbitant the private health service, the exorbitant prices that they're charging their members for access to cancer treatment. What's the latest in terms of that conversation?
So the access to medicines in the private sector is really very expensive. But having said that, trastuzumab is now available in the public sector, which was never made available previously.
Okay.
And what we're hoping is for negotiations, and the minister is really excellent at this, negotiating prices down, to be able to make more of our women have access to trastuzumab. But the other issue is, I mentioned to you last year, after the president made the announcement around the campaign, we immediately started auditing our public health facilities in terms of their readiness to deliver, especially radiation oncology services. And what we were able to do is to identify and classify them in terms of those that required minimal capital, those that required more capital, and those that required a total overhaul. But also having done that, we were also able to use monies from the National Tertiary Services Grant to be able to meet needs specifically to the needs of those people in those provinces.
But of course, there's still challenges.
There are many challenges, but
we know in KZN there was a time when they were saying there's only 2 oncologists left who were overburdened.
Yes. So you allude to a very important point. There's no use us accessing equipment and consumables if we don't have human resources. And so the plan of the department under the branch manager, Dr. Pillay, and guidance from the minister, we are moving towards determining how do we bring these two together. Oh, no, much more than 2. It will be looking at equipment, maintenance of equipment, because remember in KZN the issue resulted as a result of poor maintenance. So the availability of expensive radiation oncology equipment, how do we maintain it? But linked to that is how do we ensure that there's...
How do we capacitate the people who are supposed to run those...
And provide the service.
That equipment.
Yes, so you will recall a little while ago the president also made an announcement around providing or ensuring that we have essential access to human resources, and we are expecting the minister to talk more to that, including other grants that have become available for equity, because at the moment we are struggling to meet the requirements of the NDP. If we have to overcome inequality and poverty, what is it we have to do? Because many of our people who continue to experience that are those that continue to experience barriers to care.
Dr. Hurribunce, how can people watching interact with the activities of Pink Drive today?
Well, on the ground, it means if you find yourself in Alexandra or in the area, then come across to East Bank Street. We are there until we finish today. It's not just about raising awareness. We're actually offering services with the clinic. The partnership is directly with the clinic.
So if you test somebody and you find that they need attention, medical attention, you're able to refer
immediately
them
into that very same clinic. Our vehicles are parked outside. I haven't been to the venue yet. I go after this interview, but most certainly I can visualize in my mind that there's fixed structures for the clinic, and there's the trucks, and there's the gazebos, and whether you go into the clinic or come to us, either way, somebody will attend to you, and if something is found, in our process, we would register the person on our registers as well as the clinic registers, and we actually help the patient all the way through. Our relationship with the province in Gauteng is a very strong one. It's almost 8.5 years old. So it's actually a working establishment and a dispensation with the MEC and the Superintendent General of Healthcare. So patients are tracked through. And I would like to support what my colleague is saying. The capacity is very, very important. And it's also important that we actually ensure that you feed into capacity in a way that actually is meaningful and effective for the person. South Africa has got a lot of challenges in terms of budgetary constraints and the distribution of capacity. But what we are saying to everybody, and especially to all South Africans, be patient as we get that answer right. We have an answer, and the answer lays in collaborating with the Department of Health as a non-profit company. It's also bringing in all the corporates.
What do you mean by an answer? Do you mean treatment, or do you mean a cure?
It's from the awareness all the way up to reintegrating that patient, that person back into society as a productive person. So it's a whole value chain. It's not only about the cure side.
So it's several conversations.
It's a whole lot of conversations. For example, what happens with the aftercare of patients, because there are numerous bodies that actually would help with that person's reintegrating back into their communities. So we actually have connections with such entities, and we are saying that the actual answer lays in the whole, not just in the one part that says diagnose you and then treat you. It says what happens after treatment, what happens when you got to recycle back for follow-up, what happens to your work situation if you are given a particular responsibility and your physical condition changes and you cannot now do what you were doing before. Who helps you to go and actually have those conversations with your employers? We have got organizations with whom we link that helps the South African citizen to reintegrate as well. Cancer is about not just the disease, it's actually about what happens to your life as a whole, and how do we catch you in your whole.
As the global theme goes, I am and I will. You are the hero of the story.
Enough said.
I have to thank you both for coming through, for having this very important conversation. Sandhya Singh is from the Department of Health, and Dr. Ashwin Hurribunce from the Pink Drive.
You're most welcome.
Thank you so much. You're watching The Agenda. I think we're about to take a break.